Cholera is a severe diarrheal disease. It can quickly lead to dehydration and even death if left untreated. This infectious illness is a significant public health concern, particularly in areas with poor sanitation and limited access to clean water. Understanding the causes, symptoms, and prevention strategies is crucial in combating this preventable disease. Cholera is caused by a bacterium called. This bacterium produces a toxin that affects the small intestine, leading to severe diarrhea. The disease primarily affects developing countries, often in areas with inadequate water treatment and sanitation facilities. Cholera is a disease of poverty. It thrives in places where access to safe drinking water and proper sanitation is limited. The burden of this disease falls heavily on vulnerable communities. Recognizing the symptoms of cholera is crucial for prompt diagnosis and treatment. The hallmark of the disease is profuse watery diarrhea, often described as rice water stools due to their appearance. Other symptoms include vomiting, muscle cramps, and rapid dehydration. Cholera is primarily spread through contaminated water and food. The bacterium thrives in aquatic environments. When water sources are contaminated with fecal matter from infected individuals, the bacteria can rapidly multiply. Consuming contaminated water is a major route of transmission. This can occur through drinking, using contaminated water for food preparation, or even washing fruits and vegetables. Street food vendors using contaminated water pose a significant risk. Food can become contaminated if prepared or handled by infected individuals who haven't washed their hands properly. Shellfish harvested from contaminated waters can also harbor the bacteria. The risk of contracting cholera increases significantly in overcrowded areas with poor sanitation. Inadequate sewage disposal systems and open defecation contribute to the spread of the bacteria. Natural disasters like floods and earthquakes can also disrupt sanitation infrastructure, leading to outbreaks. The symptoms of cholera can appear suddenly, usually within a few hours to 5 days after ingesting contaminated food or water. The severity of the disease can range from mild to severe. Some individuals may experience no symptoms at all, while others develop life-threatening complications. Rapid dehydration is a hallmark of cholera. The profuse diarrhea and vomiting lead to a significant loss of fluids and electrolytes from the body. This can result in sunken eyes, dry mouth, decreased skin turgor, where the skin remains tented when pinched, and a rapid heart rate. If left untreated, severe dehydration can lead to shock and organ failure. In severe cases, patients may require hospitalization for intravenous fluid replacement and electrolyte management. Diagnosis of cholera is typically based on the clinical presentation and a history of exposure to contaminated water or food. Laboratory tests, such as stool cultures, can confirm the presence of bacteria. Prompt treatment is crucial for improving outcomes in cholera patients. The cornerstone of treatment is rehydration, which involves replacing the lost fluids and electrolytes. Oral rehydration salts, or ORS, are highly effective in treating mild to moderate dehydration. ORS is a simple and life-saving solution that contains a precise mix of sugar, salt, and water. It helps to restore the body's electrolyte balance and rehydrate the patient. In severe cases, intravenous fluids may be necessary to rapidly correct dehydration. Antibiotics can shorten the duration of diarrhea and reduce the severity of the illness. However, rehydration remains the most critical aspect of treatment. Nurses play a critical role in the care of cholera patients. They monitor vital signs, administer medications, and provide emotional support to patients and their families. Nurses also play a crucial role in educating patients and their families about proper hygiene and sanitation practices to prevent the spread of the disease.